Hello, friends, and welcome. Today we are doing a video on how to help alleviate constipation. So our number one video for leaving number two. Sorry, no more poop jokes, right? All right, so what I have for you today is top 10 with a couple of extra thrown in there, tools that we might use to help alleviate constipation. So number one, and these aren't necessarily in any particular order, but the first one is hydrate. So we want to make sure we are fully hydrated as much as possible. One of my favorite recommendations for this is you get a mug, hot water, half of the juice of a lemon. That might be a lot for you. Start with what you can tolerate in the mug, and then I put 3 ice cubes in so I can drink it quicker because I'm always in a rush. So that's the option for that. You can also add other things into that, ginger for digestion, and then if you want to go double duty, anti-inflammatory, turmeric and black pepper. So sometimes I do that, especially in the winter. It feels nice and good. Otherwise, I believe the current recommendations for hydration are half your body weight in ounces. So if you weigh 100 pounds, you drink 50 ounces of water per day. So if you're drinking too much, that's not always good either, but usually if you're constipated, that's not your issue. So what can cause constipation? Getting older, our digestion doesn't work as well. Medication that we're on can affect it. And not moving if we're too sedentary, and also maybe some of the foods you're eating. One of the, so back to our list here. So one of the great yoga poses and yoga therapy poses that we use is called Apanasana. And the translation for that is wind relieving pose, which means we're just trying to get that wind out. Maybe if you fart while you're doing this, that's not a bad thing. So let me show you how that looks. So you're going to come down onto your back. And there's a couple of versions that you can do of this as well. So you're on your back, knees are bent, hands on your knees, and we're going to have the shins parallel. So one option is we just exhale, bring the knees in towards the chest, inhale, knees go out. Do that a couple of times. You want to keep the head looking straight up. That's option 1. And then option 2 is if that's too much on your spine, you can do one leg at a time. Exhale, knee comes in. Inhale, knee goes out. And you can keep the leg up if you want, or set it down on the floor. So those are 2 options for that. And then just roll over to your side to come up. All right, so there's a couple of other things that can cause, move this back a little bit here, that can cause constipation besides the ones I listed. Autoimmune disorders can cause constipation issues. And so when you're actually seated on the toilet, there's a couple of things that can help. So I would call this roller coaster arms. So if you're seated, you got feet on the floor, you can bring your arms up like this and just hold it for a couple breaths, and hopefully that might help move things along, so to speak. But probably not yelling, screaming in the bathroom. All right. And then here's another one. I'm going to call it rock and roll. So if you're sitting on the toilet and you got something that's a little stuck, you're just going to rock back and forth. All right, that might help. Instead of straining too much, that might get things, again, moving along. One thing that I've used in the past is, I know this sounds really weird, but blowing your nose. So you're just on the pot, blow your nose, and there's something with the pressure. When you're blowing here, it's releasing the pelvic floor. which brings up another one. This isn't on my list. I've got some extra ones in here. If you have pelvic floor tightness, there are dedicated physical therapists who work with pelvic floor issues. So that might be something that you need to do. I'm up to number 5 here, and number 5, again, not in any particular order, exercise. So when we move, organ systems in the body are moving. So that's another way to get better flow, is actually to exercise. So walking, swimming, something that is moving a lot of the whole body. All right, number 6 I have, and this is more of a yoga tool, and it is called mudra. So there's two, so the idea of a mudra is 2 parts of the body touching. So it can be, you know, a foot to a leg, or an arm to your shoulder, or something like that. We're talking hands here. So this is a hand mudra. In yoga, each of the fingers have an element, and lucky us, we have 5 elements. So the thumb is fire, index finger is air, middle finger is space, ring finger is earth, and pinky is water. Maybe you've seen the SpongeBob, water. So he's actually using the right finger for that element. All right, so how are we going to do this with constipation? So we're going to look at the earth element, and there's 3 things to do. So the thumb is fire. That's going to increase the other elements. So we want to increase earth or decrease earth. We want to decrease it because it's stuck. So if you have diarrhea, then you want to increase it to hold that from. All right, so first one is balance. To balance that element, tip of the thumb, tip of the finger. So that's our balancing that earth element. If we want to increase, which is not what we want to do when we're constipated, is thumb at the base of that finger. So if we want more space in the body, we want more air, we want more water, base of the finger. Since we're working with constipation, we're going to take the thumb on top of that knuckle, and that's going to hopefully work for you. So how long? 15 minutes. Take a couple of breaths. Close your eyes. Maybe a little relaxation going on. And then maybe that works for you. Again, not everything's going to work for everybody, but we're going to try. And I'll explain that with yoga therapy. We don't do everything all at once. So we're not going to do all 10 of these things at one time. We're going to take 1 or 2 and start with that. And if that works, we keep with that. If it doesn't work, then we put that to the side. We try something else. If we put all of them in at once, then we don't know what works, and we don't know what to take in or take out. So step by step is the process that we take. All right. So number 7, I have diaphragms. And what I'm talking about is, in yoga, we are looking at, this is our respiratory diaphragm right at the base. It's all the way around the rib cage. And then the pelvic floor diaphragm, and then the thoracic inlet diaphragm. So this is our torso, those 3, another 5 in the body. That's another video for another time. If our diaphragms are not synced up, that could cause some issues. People who pull in their belly can have the diaphragms going the wrong way, or if you've had a shoulder or collarbone injury, this diaphragm can get out of sorts. Pregnancy or other kind of issues on the pelvic floor can cause incontinence, as well as might give you some issues with constipation. All right, but we'll do another video on that sometime. All right, so this next one is something that if you have any medication that you're on, check with your oncologist, anything like that. Not medical advice, but if you want to trust but verify, do your own research here. Magnesium, so it is a muscle relaxant that also works on your soft tissue muscles. So that's your digestive system. and other electrolytes as well. So we talked about hydration at the beginning, but this can be a factor as well. So that's something to look at. There's a couple of different types of magnesium. So you may be able to tolerate one better than the other. And please don't take more than you think. Just if one's okay, five's better. There's a book out by a famous prince, and in the book he talks about taking too much magnesium and poops his pants at his friend's wedding. So not too much. All right, so our number 9 is twists. So there's a lot of poses in yoga that we do twisting in. Seated, supine, when we're doing any kind of standing poses with a twist. All of those are excellent. And along with that one, I'm going to add the squatty potty. I don't have one, but if you think about it, and I'm going to do a yoga squat here. If you think about it, before toilets were invented, how did we go? We squatted, right? So in modern times, if we're sitting up higher, it's a lot harder to get things to come out. So what the squatty potty is it's a step stool that you put your feet up on while you're sitting on the toilet. All right, twist. We can do a couple. This one, where we've got the twist. Do both sides evenly. And then my last one is, for my top 10 anyway, is a couple of breaths that I have. So one is called Bhastrika, it's breath of fire. And the other one is called Kapalabhati, and that is skull shining breath. So both of them are going to heat up the body. And that's what digestion is. It's heating your food to break it down, to absorb the nutrients, and then out it goes. So the first one is, let's do Bhastrika first, breath of fire. It's a hard inhale and a hard exhale. And it's all diaphragm. I'll just do one round. We're going to inhale and exhale. And then here we go. So you can do 10 breaths. And then do 3 rounds of that. Do a couple of your regular breaths. That one works with your circulation system. That's going to get sweating just doing that a little bit. All right, the other one, Kapalabhati, is skull shining breath, and that one works with your lymphatic system to help drain that out. And that is just a hard, soft inhale, hard exhale. And again, you can do 10 breaths, take a break, and do 3 sets of that, and then come back to your regular breath. So I have videos of those, both of those somewhere else. All right. So bonus round, a couple of extras. If you're interested, you can look into Ayurveda, which is yoga's sister science, and it's all about eating seasonally, eating the right foods for your body type. There's the 3, Pitta, Kapha, and Vata, and all of those different ideas with that. So there's also things to consider. Caffeine and alcohol are going to affect your digestion. Chewing your food. So if you take big bites and just swallow it whole, that's going to make it harder to digest. So we want to chew it up, get more saliva in the mouth. That helps it come down. Smaller pieces, easier to digest. And along those lines, when you inhale food, you're so hungry, you're just like, if you work on this before you take a bite, inhale, exhale, and then put the food in your mouth. If you do it while you're inhaling, that can lead to burping and eating too fast, eating too much, all those kind of things. And then the last one I'm going to leave you with is massaging the belly. So there's two parts to this. One, we're going to go up, ascending colon, transverse colon, descending colon. So you're going to go right hip up, over to the left side down. Clockwise. There you go. So I don't know if the video is backwards, but I'm going clockwise. Right, up, down, left, over. All right, that's one part of it. And then the second part is our favorite topic, vagus nerve. There's so much about that that's its own video too. Anyway, so with this, we're going to look at cutting the abdomen into fours, so 4 quarters, and then playing with paying attention to your saliva. So I'm salivating already just thinking about this. So I'm going to just pick one quadrant, and you're going to either pull away, just the skin just kind of pulls away, check for saliva, go the other way, and that one does. So you can do that with each of the quadrants, test it and check it, and that's going to tap into that vagus nerve, which is part of the parasympathetic nervous system, which is rest, digest, and repair. So that's a whole nother video, but that is something to work on too. So hopefully in that whole list of however many, more than 10 anyway, something resonates with you and works for you, and everything goes a lot more smoothly from now on. All right, so drink your water, and we'll see you next time.